to the 1 in 50 podcast from the Brain Aneurysm Foundation. I'm your host, Christine Buckley. 1 in 50 is the number of people living with an unruptured aneurysm, which is equal to 6.8 million people in the United States. A rupture occurs every 18 minutes, and tragically, half the people who rupture will die. These statistics need to change. The Foundation's goal is big but critical: to create a world free of death and disability from brain aneurysms. Let's reach those unaware of the danger, because awareness can save lives and prevent tragedy. Knowing the signs and symptoms of brain aneurysms can be the difference between life and death. Welcome, Sharon Epperson, CNBC Senior Personal Finance Correspondent. We are so happy to have you on the 1 in 50 podcast. So thank you for joining us.
It's great to be here. Thanks so much for having me.
All right, Sharon, let's get a little background on you. So where did you grow up?
I grew up in Pittsburgh, Pennsylvania. My mom still lives in the house that I lived in for most of my life. I went to public schools in Pittsburgh and really got my start in journalism as a high school student at Taylor Alderdice High School in Pittsburgh.
Okay, so was that in high school? Did something spur you to want to go on and do that in college and then professionally?
I had a fantastic teacher, English teacher and journalism teacher. She did both when I was in high school. And when I was in 10th grade, she suggested that I apply to participate in a program that was being started by the Pittsburgh Black Media Federation. And it was a high school journalism workshop that met for 10 or 12 consecutive Saturdays. So full day. So we had to give up our Saturday, but we got a free lunch. And she said this would be something that she thought would be interesting for me to do. And I'd already been doing some advertising campaigns and radio and writing for the school newspaper. She was trying to give us a feel of various aspects of media. And that's exactly what we did in the Saturday workshops as well. And I loved it. And I loved all aspects of it, but I was especially drawn to the TV part.
That's amazing. So you were actually putting in a lot of work early on. So that's great. Yeah. And then you continue to education at Harvard University, I believe.
Yes, I did. I did my undergraduate degree in sociology and government at Harvard, but at the same time did a lot of internships in media, working on a documentary, working for the local paper in Boston, for the Boston Globe as an intern, the Wall Street Journal as an intern, Washington Post as an intern. So I did a lot of various internships. One of the favorite ones that I did, though, was working on the civil rights documentary Eyes on the Prize.
Wow, that's amazing, all that you've accomplished. What's different today in media, just in general, with just all the different platforms out there? Has it changed much for you?
Oh, my gosh. It's changed so much, because I now, when I started my career, I decided that I wanted to be a magazine journalist, but I did have an interest in television as well. And the person who hired me at Time Magazine in 1993 was someone who had foresight to say, you should be an omni journalist. You should keep a video camera in your desk, and then when you're sent out for the magazine to report stories, just film some of what you're doing. That's now how we have to operate as multimedia journalists, as MMJs, writing for digital platforms, being on camera, and then also making sure that we're contributing regularly to social media. So it's kind of like I started my career knowing that I'd have to do a bunch of different things, and thankfully enjoying doing them. But it does make it, you want to be accurate, you want to be timely, and then you want to attract the audience that's on that platform. And it's a little bit different way of telling the story each time.
Yeah. So you're always on the go. That I know. So you're, have an amazing career, but then, what we're really here to talk about, these things called brain aneurysm. So tell me a little bit about your journey with your brain aneurysm, how it was detected, what was your first reaction, how did your family deal with it?
One of a woman in finance that has been a great kind of mentor from afar for me recently posted something on LinkedIn that said, no matter your accolades and your achievements, when you don't have your health, that's the only thing that matters. And so, as you're saying, I was doing a lot. I was very, very busy in the fall of 2016. I was piloting a few new shows on digital platform. I was filling in for anchors on TV, on CNBC TV. I was writing. And at the time, I had a child who was just starting middle school and another one who was just starting high school. And then everything stopped, literally stopped. One day, September 21st, 2016, I was taking a core bar class, had the worst pain in my life in my head. And it wasn't a normal headache. It was something I'd never experienced before that made me stop from being in a downward dog position and get out of the studio and rush to change my clothes and get in my car and call my husband. Because once I got in the driver's seat, I realized I couldn't really turn my head and I wasn't feeling well enough to drive. Thank goodness I did not get behind the wheel and actually go anywhere. He came to pick me up and took me home, which was the first thing we should absolutely not have done. We should have gone straight to the emergency room, but I didn't know. So I'd never felt that pain before. So I went home, put my feet up. He went out, got me stuck. Another thing I probably should have done. And when he came back and I still wasn't feeling well, he took me to see my primary care physician. She was not there that day. So the primary care physician that did see me, thank God, just thought about the worst case scenario. And at that point I was nauseous. At that point, I was in and out of consciousness. And my husband was in the room with me. And he said, you need to take her to the emergency room right now. Yeah. My husband said, where's the ambulance? And he's like, no, you'll get there faster than the ambulance getting here. We'll take her. So go right now. And so I went to the closest hospital and I had a CT scan. And that's when they found bleeding on my brain. I immediately called my sister. They're just two of us. We're very close. She lives in Washington, D.C. I live in the New York area. And I said, this has happened. This is what I call her out of a meeting. She's a law professor. And I said, just don't tell mom, but I want you to know. And she was on the next train to New York. And as I was being transported to a academic medical center here in the New York area, Montefiore health system, to have a craniotomy. So when I got to the hospital, they decided after an angiogram and many tests that I needed to have a craniotomy, that they were going to insert. They ended up inserting 2 clips to stop the bleeding of the middle cerebral artery, which is where my aneurysm had ruptured. And all of that happened. I'm a journalist, right? So I actually read the post-op note. All of that happened between my 9 a.m. core bar class and 11:57 p.m. that same day. Wow. So I was at 3 different medical facilities, and I was in surgery. And I don't know how many people, I stopped counting how many people touched me that day, literally and figuratively, and saved my life.
Yeah, that is an amazing day in a very short period of time. So much happened. So had you heard the term brain aneurysm before all this happened to you so suddenly and quickly?
I hadn't. I think I had heard the term brain aneurysm, but didn't know anyone who had ever survived from that. My son had a classmate whose father passed away from a brain aneurysm. So I was familiar with the term. What I didn't realize was that, a ruptured brain aneurysm also often causes a subarachnoid hemorrhage. And that word, cerebral hemorrhage, I had heard because my mom had told me time and again that the grandfather, her father, who I never met, had passed away 4 months before I was born of a cerebral hemorrhage. So I'd heard that term before. I also knew that her sister, that I was able to meet, but who passed away when I was about 2.5 years old, had also died of a cerebral hemorrhage. And what I found out a few months after my aneurysm rupture was that my mother's grandfather, my great-great-grandfather, had also passed away from a cerebral hemorrhage. So at the time that they all passed away, there was no MRA. There was no, analysis of the exact cause of that cerebral hemorrhage. But it's my feeling that they likely had brain aneurysm ruptures as well. And that family history component, which I learned from the Brain Aneurysm Foundation, and always looking at the fast facts that you have there, and the statistics that are so helpful. I really found out what I was going through as I was going through the recovery by the resources that you provide at the Brain Aneurysm Foundation.
Well, I'm great to hear that the foundation was a resource for you. But yeah, for people who don't know, it's about 25% of the time that brain aneurysms do run in families. And, just as we're doing this podcast for awareness, in education. I mean, some things that we want people to know, that brain aneurysms are very treatable. So if you know the signs and symptoms, and to be your own best advocate, and it's that scan, we can't stop the ruptures from happening, but if we can get people to know that they have this aneurysm and get it treated prior to rupture, that is definitely key. But thank you for sharing that.
Absolutely.
Go ahead.
So Christine, because I'm a mother of two, and I have a sister, and my mother is still living, I'm very concerned about the family history component. So within the first year after my aneurysm rupture, my sister and my mom both had brain MRIs, MRAs with contrast to make sure that they could see everything. And my daughter just recently had a brain MRI as well, because she was having some blurry vision, and we just wanted to make sure. So I still need to have my son get tested. I've told many of my relatives, my first cousins, about it. A couple of them have already had imaging done as well. But it is so very important if you have a family history, to make sure that family members get checked.
No, absolutely. And I'm sure, just with your involvement and people you've talked to in support groups, the treatments keep getting better and better.
And better. Everyone says, so this was 2016, Christine, when I had a craniotomy and 2 clips put in to stop the aneurysm. And the person who was the attending physician on my case, who's now the head of one of the co-heads of the stroke center at Montefiore Hospital, said he would have used a different procedure today. So it changes so quickly. And again, you all provide such great information about the cutting edge technology that's being used, that can be used, and to at least be able to ask the questions.
Yeah, no, absolutely. So, I mean, you are obviously somewhat fortunate. You got care pretty quickly. Look at you back in action. But it's one thing for somebody to see you like this now. Can you talk a little bit about the recovery journey and like the greatest challenges that came up then and getting back to the workforce? Because I know from, the many stories I've heard, there's a big difference between what happened September 2016 to taking a look at you now. No one would ever know.
Yeah, it's a big, big difference. But when I woke up in ICU, I remember telling my sister, why did this happen to me? What is going on? To see all of the different needles in my arm, and the bags that I was attached to, and I couldn't walk, I couldn't lift my head. It was so, so frightening. And I think that is the greatest gift that I was given, that I was able to have family members and people that I knew and trusted around me. But I will say that the nursing staff, the cleaning staff, the person who would bring in food when I was able to eventually eat solid food, but that didn't happen for a long time, but that they were really, really essential also. And so, having great surgical team is of course key, but every single person that comes into your hospital room is important and plays a role. And every single person did in my case. I was in ICU for 10 days or so. The final day or two is when I actually was able to get up, and they did make me try to walk with assistance. I can't remember if I had someone I think I had someone holding me the whole time. I don't think I had a walker, but I can't really remember. But I definitely remember having assistance. And I remember looking to the sides in other rooms and then looking straight ahead, because I knew that that's where I was, that's where I could go back to, and that some of those people would not be coming out. And it was very, very, that also was very scary. I think one of the other key moments was when I got into a regular hospital room, and they said, you're doing well, and you can be discharged soon. And I was like, discharged to where? Because I knew that I was not anywhere near the person that had entered that, that was that person the morning of the 21st of September, 2016. And my neurosurgeon was phenomenal and had done, I don't know how many clippings, more than 2,000, very renowned in the field at the time. And he was like, you're 99% cured, because I have clips on your brain. You don't have a ticking time bomb there anymore. And I was like, no, I'm not. I have a mother and I have a career, and I can't imagine going back to them. So I did go to a rehab hospital for 2 weeks and as an inpatient. And I think that was really key in making sure that every single day, and because I've, had this career and I've worked full time since I was, 20 some years old, I took it as a job. So I was never one of those people who didn't want to get out of bed and go to therapy. No, I was that person every day, but I got out of bed and went to therapy because that was my job to get better. And so occupational, physical, speech therapy, neuropsychological therapy as well, very important. So I did all that as an inpatient. And I'm really happy that it was actually a first year resident who told me privately on her private email, she emailed me to say, I know the neurosurgeon said that you could go home, but if you feel like you need to have more care, then we can help you find a neuropsych person. And that was really important to me. That was particularly when I was leaving the rehab hospital to come home. So I did I've continued to do neuropsychology therapy for the last 8 years. So I started in November of 2016, and I will never leave my therapist until she.
Yeah, no, it's important.
I will never leave her. I had a neuropsych evaluation before I came back to work from someone who specializes in that, also key, so that they could understand what I could come back to work and do. And what I was able to do after 12 months, which is how long I was home doing therapy outpatient like it was my job, I came back to work 3 days a week, 4 hours a day. And that was in the fall of 2017, 1 year later. And I maintained that schedule until March of 2020 when the pandemic hit. And when the pandemic hit and I saw colleagues that I was just worried about keeping my job and I knew I couldn't do it, I said, I'll go full time. If you need full time, I'll be full time. And I could because I was home. And so I did full time throughout the pandemic from home. And I now work 3 days a week outside of the home and 2 days a week from home. I pretty much keep to that schedule. And my neurologist says I probably will have to maintain that schedule for the rest of my career.
Yeah. Well, I mean, it is amazing what you have done, but I think some of the things that you did well, and it is hard, and you hear patients all the time, like surgeons, I mean, amazing, right? They save the lives. But they also, I think and I see a lot of change in it now, a lot more, even some research studies being done on patient outcomes and really how good is this patient we're sending home. We're telling the patient, yeah, you're fine. And you go back, the sticking time bomb is gone. But how do you go about your day-to-day life? So I think it was amazing that you had a year that you weren't going back to work and that you got back in slowly, because we just hear so many times some people aren't fortunate enough just because of their rupture where it might have happened to even go back to work. So, and again, the neuropsych piece, all the therapies, all the recovery part, it takes time. And I think, you're not the same person. You are a month out of recovery, 6 months out of recovery. There's that constant change and improvement, but there's still little things. I know for so many people where they know they're just not the same. People on the outside looking in don't necessarily see it, but I think it is really important for anybody who hears this. And if they have gone through it, if you're newly going through it, to take that time and actually kind of treat it like it is your job, your recovery.
Absolutely. And another key part is that for those people that have a sense of community at their job, or even if you don't, if you're a solo entrepreneur or what have you, there's still a community that you build. You need to build that community in recovery. And I would have to say that support groups are absolutely essential to that. And when I was able to finally be healthy enough to travel, I also continued my support groups as much as I could, and weekly is what I was trying to do. And so, as you know, I actually went to a brain aneurysm foundation support group in Boston when I was there, for a personal reason, just to be with family and friends. But I made sure to go to a support group meeting because I needed to be with my people that understand, kind of what I'm going through. And even now, this many years out, I need to get back to the support group because I've been going through more anxiety, more, some bouts of depression that from the research that I've read on the BAF website, as well as other places, that we're more susceptible after something like this to anxiety, to depression, and to other mental health issues. So it's really important to stay in touch with people who have been through it, with, members of the medical community that understand it, and that can help you and help your caregivers also understand what you're going through.
Yeah, no, the support groups are key. They're important for the patient and the caregiver oftentimes, because for them. I mean, again, different varying variations of recoveries of people. The caregiver role is certainly very taxing as well. So we are happy in one thing after COVID, God, it was such a bad time for so many things, but these support groups that we had around the country, some of them have maintained that online portion of the support group. And
Yeah.
there's so many support groups now that, have those local people, but there's people from all over the world that join. And I
Yes.
think, as you know, they bond, they become family, they come to some of the national events that we have. So yeah, it is critical for years to come in the recovery. So we're happy to be able to have that resource. But again, since your recovery, you've just become such an amazing advocate for the disease and the foundation. So can you just tell me a little bit, like, what's important to you about the advocacy work when we go to DC and about the research funding?
I do want to talk about DC, definitely. But before that, I wanted to just share, you said that it was really an uncommon thing for me to be able to take the time that I did to have for my recovery and through my employer. And I understand that that's true. But the other thing that I think is really important, particularly because we're talking about this during April Financial Literacy Month, is the importance of having your finances straight when you are well, so that when something happens unexpected, you'll be okay.
Mm-hmm.
So automating everything, having automated, my mortgage payments are automated, my electricity bill, I have oil for my heat, all of that is automated. So that was just on autopilot when I was ill. But the most important part, and the reason why my husband and I were able to maintain our home and maintain our lifestyle, is that I had disability insurance. And no one expects to become disabled. No one expects something like this to happen. But you're more likely to become disabled while you're working than to pass away. And so this is an insurance that may seem so expensive, but it is so important to have. And many larger companies offer it for their employees, but getting it on your own also it's just very important. So it's an expense that's really, really important to make sure that you are protecting your income. And with the volatility that we're seeing in investments in the stock market right now, this is something you can count on. You may not need it, but you can count on it being there for you. So make sure that you look at that and make sure that you have that kind of insurance, and get the best health care that you can, the best health care that you can afford, so that you can, there are going to be many letters that you're going to have to write probably.
Oh, yeah.
To get the care that you really need, because the health insurance companies, they're not like, yep, you can do that, you can do that, you can do that. There's a lot of work to do. But I think that that's really, really important. And I express this in my advocacy to answer your question, Christine, because everybody knows somebody that's been impacted by this disease. Everybody. And so when we go to Capitol Hill every year for Advocacy Day and to talk about brain aneurysms, there is always at least one person on a congressional member's team, either the congressperson themselves or one of their staffers, who has been touched personally by brain aneurysms. And with the amount of funding that we are requesting, because of the lack of funding that exists from the federal government for brain aneurysm research in particular, it's just so very important. And I know this is not a time that it's easy to get federal funding for health issues, period. But this is so very important. And I think it's great to be able to raise awareness on Capitol Hill. It's great to be able to do it with a community that is so interested and supportive in terms of what we're doing. It's like a day long or day and a half support group meeting for us as we're doing this, and we're advocating for what we're talking about. But it's also just so important to raise awareness, for these people to realize that it might have been a grandmother that they lost, or or a family member that's recovering, or what have you, but that they're not alone. And to hear the different stories of those of us who have lost family members to brain aneurysms, those of us who are survivors and working through it. And the beauty is when medical staffers also come and share what they're doing, researchers, scientists, doctors, to make it better, and to show actually and to explain how the funding is being used. My favorite, Christine, is, because I'm not a scientist, if I can take a blood test, as much blood as they take at your annual physical, if one of those vials could be used to show whether or not I have an aneurysm, I
I
want to
know.
support that. I want to
I
support
know.
that research. And I can't imagine that any congressperson, regardless of their political affiliation, would not want to support that. So what I love is that this has been a bipartisan push.
Yes.
And that the support that we've gotten from both sides of the aisle comes together on this issue. I just wish we could make it happen with more of the members doing that and make it more money
Yeah.
going to this research.
Yeah, no, absolutely. And just so people know, we have a legislation called Ellie's Law seeking $20 million for 5 years, so $100 million in total. And I think we've been at it for probably 7, 8 years. And I know there were some people a little bit hesitant about joining us this May, but like you already mentioned, we need the money, yes, but the awareness and the education and spreading the knowledge of the signs and symptoms and risk factors for people to know that we meet with in these meetings is just as important as the end result. We haven't received the money yet, I tell people, so there's no reason to stop now, right? And when we're in those meetings, we don't even care what side of the aisle anybody's on. We present the facts. People like you who are impacted share their stories, and they're very moving meetings. So, I'm really happy that we are going back. We have probably about 80 something people coming again this year. So we're as strong as we have been in the past from about 23 different states. So there's nothing like it. And to, be in our nation's capital and to tell this story. And we're not going to stop until at some point something happens. But the research, again, we said how good the treatments are and they keep getting better, but there's so many other sides to the research and the early detection side. And again, that if we can find that blood-based biomarker, that would be amazing. There's a lot of advancements with AI. There's obviously looking into, male versus female, the prevalence there, the impact of smoking, African-American and Hispanic community. So there's so many different aspects of this disease that still need to be looked at through research. Again, the key for this organization is to prevent disabilities and deaths from brain aneurysms at some point in time. So being on the Hill with a community, like you said, it is like a big walking support group. And, I love the training the day before. And then that time when we come together at the end of the day in the Hill, when everybody is totally exhausted, but, sharing their stories. So definitely looking forward to it and appreciate the fact that you've been such a supporter of research. And I think, this year, our annual research symposium will be in Scottsdale, Arizona on September 11th. And again, we're going to have a national support conference the day before. So very much looking forward to that. But I'm
really looking forward to it too, Christine. And I think it's another thing that's important to bring up is, as we're learning as survivors, as people who have lost family members, as parts of the medical community, as we're learning together in the preparation for being on the Hill, it also confirms to me that the money that I'm spending or that I'm donating and raising personally is going to what I really care about. And so I think that, the 80 people that are able to make it to Washington, that's wonderful. But no matter where you're listening, no matter where you sit, you can make a difference. Right. And what I love is the ease that the Brain Aneurysm Foundation provides in creating events that that your friends, family, loved ones, colleagues, and general public would want to come to, where you can raise money for the Brain Aneurysm Foundation. And so during the pandemic, I did a walk around the high school in my neighborhood as a way to raise money for the Brain Aneurysm Foundation. I've done walks all over in New York City for several years. Yeah. I'm hoping to do a yoga event around in May, which is Stroke Awareness Month. And again, hemorrhagic strokes caused by brain aneurysm ruptures. People don't understand that many of us are stroke survivors as well. And so, the Brain Aneurysm Foundation makes it very easy to explain what people need to know about this, to get interested in participating, and then to make sure that the dollars go to research and to education and making sure that people are aware of this disease.
Yeah, no, thank you. That was lovely what you just said. But, as we are wrapping up and people are going to hopefully take something away from this, what is the one thing that you really want people to know about brain aneurysms?
Well, the one thing I want people to know about brain aneurysms is that they need to listen to their body for anything that seems unusual. If I had not listened to my body, if I had tried to power through that worst pain I've ever felt in my head in my life, I wouldn't be here today. And so taking time, it's hard to do that when you're so busy doing multiple things at the same time. We're all multitasking, but we have to take the time to stop everything and just breathe and listen to our bodies before our bodies stop and tell us we can't continue.
Yeah, no, I appreciate that. And I just like to tell people it's a very treatable disease, right? But people need to know that they have it so that it can be treated appropriately. And the other thing I think people need to understand, it can hit anybody. The average age is 35 to 60. So it's, I mean, so much prime of life. And like you said, I think the disability insurance, that advice is, so important for people. I know we all think like, what do we want to spend our money on? We're already paying X amount for insurance, but from the number of people that I've met, I think that is, just fabulous advice. And again, we want to keep communities, families, and workforces together. So again, to raise awareness and education any way that we can, which is part of the reason we came up with this 1 in 50 podcast. It's just another way people listen to things and hear things differently. And we just thought it'd be another great venue to get information out there and hear from people like you who are so eloquent and willing to share their story, which is amazing because I know it's hard to talk about it all the time. And thank you again for wearing our brain aneurysm red. That's always a favorite. I love it. So I just want to say thank you to Sharon Epperson for being part of this 1 in 50 podcast. It's been amazing to have you, and hopefully we'll see you soon in DC.
Absolutely. And thank you and the Brain Aneurysm Foundation for all of the work that you do. And as you're listening today, please share any bit of information that you heard today that resonated with you. Share it with someone. Don't keep it to yourself. Share it with someone, text it, put it on social media, tag the Brain Aneurysm Foundation so people know where they can find more information. But please share. That's what we're all here to do. We're the community together.
Yeah. Thank you, Sharon.
Thank you.